Well, this morning, a new study is shedding some light on the possible brain health benefits of popular weight loss drugs like Wegovy and Ozempic, specifically their potential to lower the risk of dementia and stroke. Dr. Natalie Azar is here to break down the findings. Almost feels like every few weeks now there's some new report out that's extolling the virtues of these drugs.
Yes.
But this particular study, what did it focus on? What did it find?
So this was a study that looked at the medical records of over 60,000 people worldwide who had type 2 diabetes and obesity. And they found that individuals who were put on either semaglutide or tirzepatide had a significantly lower risk of dementia, stroke, as well as death from any cause. Take a look at these numbers here. Individuals who took either that's Ozempic, Wegovy, Zepbound, or Mounjaro, 37% decreased risk of dementia, 30% decrease of dying from any cause, and a 19% decreased risk of stroke. They also looked at whether or not it decreased the risk of Parkinson's. They did not find that. But another thing that was interesting, the most effect was seen in people over the age of 60, in women, and in people who had a BMI of 30 to 40, likely because they had more there that they could actually work on. Yeah.
Well, it's interesting to see these different and benefits that weren't expected from these drugs. We're also seeing that now they're saying 1 in 4 people after a couple of years are getting off the drugs.
Yes.
Do we know why?
So obviously we talk about cost and insurance coverage, and that's definitely a big thing. But one of the biggest things is side effects. So these authors sort of suggest this nice acronym that I think is really going to be easy for people to remember. It's MEAL, M-E-A-L. These are the things that we want people to think about when they're taking these medications. The M stands for muscle mass. In addition to losing weight, people on these medications lose a ton of muscle. So you want to aim for about 20 to 30 grams of protein per meal every single day. If you're having a decreased appetite, you can definitely supplement with a protein shake. Energy balance, you're eating less, so you're going to feel a little bit more sluggish. Having smaller, more frequent, nutrient-dense meals can really help that. Avoiding side effects, I know it sounds easier said than done, but things like adding fiber for constipation, avoiding fatty foods that can decrease nausea, avoiding spicy foods can decrease heartburn, and then maintaining adequate liquid intake. People can get really dehydrated, so you want to aim for about like 8 to 12 cups of water every day. And finally, I really want to reinforce that this loss of muscle mass is kind of really important in people taking these medications. So exercise is really important, in addition to like 150 minutes of moderate intensity exercise every week. You want to aim for also 2 to 3 30-minute sessions per week of strength training.
Really quickly, going back to the study for a second, if you aren't obese, should you maybe consider taking the drug to prevent dementia or stroke?
I know, Craig, this is such a great question. And the short answer is we can't answer that because that population wasn't studied. These are people who are at higher risk for dementia and all of these things because of these underlying comorbidities. And we don't know if the benefit is just related to the weight loss and to correction of diabetes, or if it's independent and related to the medicine alone. But suffice it to say, if you don't have risk factors for dementia, I wouldn't necessarily recommend that you go on these medications to reduce that risk.
All right.
Thank you, Natalie.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.